Okay, it is week 3 of Nursing 313 at Gwinnett Mercy University, and our topic this week is ethics. These are how we apply them in nursing. You may have your own personal code of ethics, or you may belong to other groups, such as the military or a church, that has its own set of ethics, but nursing has its own code, and we do apply them. So here are our objectives. Always begin where you hope to finish. That's how you know how to get there. We will differentiate between values, morals, ethics, and bioethics. Sometimes those terms are used interchangeably. They're really a little different, if only subtly. We will identify and define basic ethical principles. We'll talk about Kohlberg's model, Gilligan's model, and we'll explain a few of the differences. They developed models that explain how we grow and develop in our moral reasoning. As it has implications to nursing, we'll discuss them. We will compare and contrast 3 normative ethical theories. We'll discuss the concept of justice as an ethical principle in healthcare delivery, discuss the relevance of a code of ethics for the profession of nursing, and understand how professional ethics override personal ethics in professional settings. Um, then we'll talk about some of the dilemmas and how to resolve them. Dilemmas occur all the time when you're trying to care for patients. Values come into conflict. Patients may present a dilemma that conflicts with your own values. Other healthcare professionals may not uphold the code of ethics and put you in a position where you now have to decide between your loyalty to your colleague and your duty to the public. Family members, institutions, all can sometimes present us with dilemmas that are difficult to resolve. So we will discuss those. We'll recognize socio-cultural challenges to professional ethical behavior, including the use of social media by nurses, and the idea of how substance abuse might present us with some ethical problems. And then we will understand the important ethical issues related to some contemporary things like immigration, migration, as well as issues related to electronic data access and privacy. So now that we've talked about our objectives, we can start launching in. There are all different types of ethics. I'm going to start with the most broad, meta ethics. Meta means it covers everything. It is all inclusive. It's concerned with very broad truths, universal truths. Most cultures, societies have always believed in honesty. Um, they've believed in kindness, justice. So those kind of categories fall under meta ethics. It's like the discussion of those universal truths and what they mean to different people in different circumstances, um, and also how we develop our ethics, how we regulate our behavior to make it good for all of society. Um, Normative ethics are a little more specific. This is the type of ethics that we normally discuss in terms of professional codes. And these are standards that regulate behaviors. You decide which ideals are most important to you, and you develop like a code of ethics. So there are different theories of normative ethics. We will explore them. Applied ethics. This is the study of how ethical principles are applied to very specific issues. Um, for example, the right to die with dignity, or euthanasia, as it's more commonly called, abortion or elective termination of pregnancy, issues related to equity and equitable access to care, and how sometimes there are differences in health outcomes for different people because of those problems. Um, Applied ethics can also be used to explore implicit bias in healthcare, and structural racism and how it impacts our patients' health. So those are just examples of applied ethics. Normally, with applied ethics, organizations in healthcare, such as, let's say, the Association of Oncology Nurses, will come up with policy statements that apply to practice. And those are usually based off of bigger sorts of ethical debates that you find in the other 2 categories. Okay, so some more basic concepts in ethics. Values. We've all heard of values. We may have personal values, and then there are shared values. Values are attitudes, ideals, or beliefs that an individual or a group holds and uses to guide behavior. So if you value um, close relationships, you'll honor those. Those values will guide your behaviors. You'll maybe be more tolerant of other people. You'll look to understand them. If you value justice, you may look to make sure that um, each side is equitably represented, and that consequences fit behaviors. So individuals have personal values, and groups very often will share values and base their ethics on those. Morals provide standards of right and wrong behavior. These are usually rule based things. Don't steal, don't gossip. It's immoral to cheat on a spouse. It's immoral to cheat on your taxes. So these are rules, do's and don'ts, may be influenced by culture and religion, and most people have their own morals based on their life experiences and how they've grown up. These morals guide individuals and social groups. People typically try to do the things that they think of as morally right and try to avoid doing the things that are morally wrong. And so you might have rules of conduct that govern right and wrong. Ethics is a term that's used to reflect the actions an individual should take based on broader principles, and it may be codified, as in the ethical code of a profession. And we will talk about the code for nurses. But ethics sort of combines all of these things, takes our highest ideals, and translates them into some statements that we sort of live by. Okay, bioethics. This is a very specific application of ethical theories and principles to issues or problems in healthcare as they arise. Very often, as technology evolves, we're seeing new applications of bioethics to genomics, to fetal tissue research, to, again, the right to die with dignity, just to name a few. And hospitals or other healthcare agencies may have bioethics committees that review cases. But it is an applied ethics specific to healthcare. We'll talk a little bit about ANA's position statement about ethics. They have stated the code for nurses is non-negotiable, and each nurse has an obligation to uphold and adhere to the code of ethics. In class, I gave the morning folks a bookmark. I still have the bookmarks for the afternoon people that have the provisions. Every nurse at one point in her career should read the entire code of ethics. It is not long. It is a book that's a little bigger than a pamphlet, and it discusses what our ethics are. To appear and uphold and adhere to a code, though, you have to know it, and you have to understand it, and you have to understand how it might fit in different situations. And that's what we'll do today. Values conflict, a situation where two values are opposing each other in a particular situation. So, for example, if I believe in truth, but I also believe that a patient has autonomy, when a patient says, I don't want to know about my terminal diagnosis, then I have to honor that. I have to make a decision between those two values. Moral distress is a response to a situation in which nurses, or really anybody, is faced with an ethical dilemma, but there's a barrier to doing the right thing. So maybe the institutional policies don't allow for the action that the nurse feels is the most ethical. So that would be moral distress. It causes a lot of emotional and mental stress on healthcare professionals and really anybody else who is in a position to behave ethically. I'm going to take a short break here, and then we'll pick up with Kohlberg and Gilligan